everybody. I'm Dr. Nagaraj, diabetologist at Infilife Healthcare Pvt Ltd. The second topic of discussion today is gestational diabetes. What is this gestational diabetes? If you take last decade, gestational diabetes was almost very rare form of diabetes. Today, with increased nutrition, weight gain, diabetes has taken a epidemic proportion where gestational diabetes also has become very common. Nowadays, what is this gestational diabetes? Gestational diabetes is a diabetes where patient will not have diabetes before starting of a pregnancy event. When patient starts to have the pregnancy, usually the blood sugars starts to go up. So especially after the 18 to 20 weeks of pregnancy, most of the patients complain that increased sugars. Most of the time the patients have been referred from the gynecologist regarding diabetes associated with pregnancy. Earlier we used to call this as pregnancy induced diabetes. Today the new concept has come as gestational diabetes. So it's very specific for gestation and pregnancy, and usually the sugar starts to rise between anywhere after 14 to 18 weeks of pregnancy, and the peak proportion of the blood sugars are after 20 weeks of pregnancy. So how do you control this? What are the problems a woman will have during gestational diabetes? Most of the women will have a lot of weight gain. There may be a big baby can be delivered, and there will be a lot of increased amniotic fluid, and it in turn increases the weight gain. So the gestational complications, it's both having complications of both mother and the child. So what are all the suggestions we need to give for gestational diabetes? Please, whenever we see the gestational diabetes, usually we tell the gynecologist to refer to a physician or a diabetologist who can handle diabetes from 14 or 18 weeks up till the event of pregnancy and their uneventful time. So what we should tell the patient is gestational diabetes is specific to the pregnancy, and most of the time the blood sugar starts to revert once the pregnancy event is finished. So most of the time, earlier we used to tell gestational diabetes doesn't convert into a diabetes in the later part of life, but once there is a gestational diabetes, we do see a lot of patients getting converted to pre-diabetes in 1.5 years. So the take-home message is gestational diabetes is a form of diabetes which occurs in pregnancy, may start to turn out to be a frank type 2 diabetes at the later part of the life. So gestational diabetes is specific to pregnancy.